Um, I think that's.
We have everyone. Yeah.
Yeah, I'm gonna let Kyle in just because he's Kyle. And
It's Kyle.
and yeah, Kaizen is here. I'm gonna start letting everyone in.
Okay, good luck, everyone.
Welcome, everyone. We're just going to give it another minute or so to let a few other folks join. All right, there we have it, quorum. Welcome, everyone. We are so thrilled to have you all here today. My name is Eamon Anderson, and I'm a co-founder of the Medicaid Innovation Collaborative, a program of Acumen America that aims to connect the Medicaid ecosystem to innovations that advance health equity. We launched MIC because we see a role for private sector tech-enabled solutions to complement all the great work that's happening on the ground to address deep-rooted disparities within Medicaid. Since we received so many amazing applications to our RFI, we decided to host two showcases. Many of you may have attended the showcase on May 22nd, focused on solutions that address food insecurity and navigation. If so, thanks for coming back for more. Today, we are hosting our second showcase to highlight innovations that address SDOH infrastructure and data management needs. We'll be looking at solutions to address benefits coordination and access, connection and navigation to community services and transportation services. Today, we'll be showcasing 5 companies that were selected because they have the potential to address the infrastructure and data needs required to manage social determinants of health in our 3 partner states, New York, Iowa, and Kentucky. These 5 companies were selected from over 100 applicants through a robust RFI and selection process that was informed by beneficiaries, managed care organizations, state Medicaid agencies, community organizations, providers, and subject matter experts from across the Medicaid spectrum. Thank you to all who participated in the selection process to help us reach this huge milestone within the program. For those of you who attended last session, we know some of this may feel a bit repetitive, but wanted to make sure that everyone was oriented to how we will host today's session. We have a few quick housekeeping items that we've noted on the slide here, and we'll also post in the chat. We also wanted to reiterate that this will be a different kind of meeting. This isn't your typical big Zoom call. The more engaged you are, the more successful this call will be. So please turn your video on and lean into the conversation. We'll be using breakout rooms to allow us to engage in smaller discussion with entrepreneurs. So please get ready to ask questions during the breakouts today. And we also encourage you to turn your video on during these breakouts as it helps support a more interactive experience. I want to thank a number of people and organizations for their assistance and commitment to this work, including the teams and partners from our 3 participating states, Director Amir Basiri and his team in New York, Director Liz Matney and her team in Iowa, and Director Lisa Lee and her team in Kentucky. Thank you. At our last session, all three directors shared their thoughts about why innovation was needed in their states to address health-related social needs. If you happen to miss that session, we'll forward along the recording after this meeting. We also wanted to thank the managed care plans participating in these states for your fantastic engagement. Thank you all. And we also want to thank our funding partners, Schmidt Futures and Molina Cares, whose support makes this work possible. We also want to thank our Community Advisory Board, who's been incredibly valuable in reviewing solutions and providing us critical feedback. They have been essential to this process. Thank you to all these partners. We couldn't do this work without you. Now, I'd like to hand it over to my amazing colleague and the Executive Director of the Medicaid Innovation Collaborative, Vinu Pollock.
Thank you, Eamon. I'm excited for today's session. We had great engagement at our last event and hoping you all are able to bring all your questions to the breakout sessions today. In the chat, we are sharing a link to the welcome packet that you should have received last week of all the infrastructure solutions. The packet provides more details on the companies and their presenters, and hopefully will be a good reference document for you today. It also includes contact information in case you would like to follow up with any of the companies after the session. So today, our program's divided into three main parts. We're currently setting the stage with opening remarks, and then we'll do a round robin of elevator pitches from our 5 selected solutions. Finally, the bulk of our conversation today will be with the 2 in-depth conversations with 2 of the companies. If you aren't able to meet with all the companies you're interested in today, please let us know in the survey that we're going to be sharing at the end of the session, and we will be happy to schedule additional meet and greet sessions. We're excited for today and spending the next hour with you. So now we're going to transition to a round robin of short pitches from our 5 selected solutions. As you listen to the presenter and are having deeper conversations than breakouts, we also wanted to let you know that we're exploring the opportunity to provide financial assistance to pilot some of these solutions in your communities. These pilots will allow us to test, evaluate the impact for people on Medicaid. So as you're digging into learning, think about this opportunity and looking for potential partners. So hopefully you had an opportunity to view the company videos that we sent, but we're going to do a quick round robin as a refresher of each of the solutions. After you hear the pitches, we'll break out into the breakout room. So you'll have an opportunity to pick 2 of these companies to go more in depth with. Additionally, rather than asking any questions during the pitches, we're hoping that you'll write down your questions that come up and then have that opportunity during the breakouts to do that. So we're going to be hearing from the companies in this order. And for the companies in the room, we're going to be strictly following a 2-minute cutoff. So as we get close to the 2 minutes, you'll see me come back on screen. And unfortunately, I'm going to have to cut you off right at 2 minutes. Sadly, I had to do that last time. So just be prepared. So get your timers out, and we're gonna stay on track. So let's start with our 2 benefits coordination, benefits access companies. So I'm gonna first queue up Benefits Data Trust and welcome Ashley to come up and share your pitch. So welcome, Ashley.
Thanks. So hi, everyone. It's so great to be here. Thank you for having me. The one thing I would like for you to take away from today is that there are $80 billion in public assistance that are untapped at any given time. So that means food, utilities, prescriptions, broadband internet. It's not being delivered to the people who are eligible and who need it. If you're a Medicaid agency or an MCO, it's likely that about 40% of your Medicaid beneficiaries are not accessing SNAP, also known as food stamps, and many of them should be. And so this is a reality that's very complex, but also a problem that's really solvable. So I'll describe to you the stakes, and I'll describe how our organization, Benefits Data Trust, approaches them. So firstly, our belief is that shrinking the benefits access gap should be one of your agency or plan's #1 priorities. 4 studies in the last 5 years have come out showing that one enrollment in SNAP can save thousands in healthcare costs per person per year. Secondly, these programs draw down money already on the table. Their month-over-month dollars is one of the highest RA solutions you can implement. So BDT, we're a national nonprofit that is singularly focused on breaking down each of these barriers that makes it so painstaking and difficult for people to enroll. There are many barriers. What makes us different? Our use of data. We have over 40 data sharing agreements with government agencies, payers, providers, et cetera. Our outreach methods to people are highly effective. We use mail, text, email with content that's been honed over 20 years. And lastly, the people on the phone in our contact center, they prioritize dignified, comprehensive assistance. Since 2006, we've helped 1.3 million households apply for public benefits. We also partner with states to implement policy and practices that make it easier for people to enroll. For example, our Medicaid Churn Learning Collaborative, whom we're working with the state of Kentucky on. So it was great to see you guys. We'd love to talk more about how we can work together. And thanks everyone for the opportunity to speak with you.
Great, thank you, Ashley. Appreciate that. So next, I'm going to invite Chris from Care Advisors to join and start your discussion. Thanks.
Thank you. I appreciate that. Hi, I'm Christopher Grace, CEO for Care Advisors. Prior to starting Care Advisors as a company, I built one of the largest navigation programs in the country, helping more than 1 million people access social services. And at Care Advisors, we provide a software platform that's integrated with live expert assistance, where we connect hospitals, health plans, and community-based organizations to build a full ecosystem for social care management that delivers health equity. So when it comes to addressing social needs for your Medicaid members, there's dozens of tools available, including resource directories, vendors, but oftentimes there's no overall organized approach to ensure coordination between your care management team, call center staff, community partners, and vendors. And that's where Care Advisors really focuses on distinguishing itself through our Symphony software, which provides one of the first platforms for social care orchestration that helps a health plan identify key population health insights and optimize a mix of supplemental benefits for social care management, and translate these insights directly into care plan logic, where you can orchestrate across your internal care teams, call center staff, third-party vendors, and community partners in one coordinated network without replacing your existing software infrastructure. Undergirding our social care orchestration platform is our unique interoperability engine called the Equity Information Exchange, which provides clinical and human services data sharing specialized for underserved communities. We also have connected to our software a network of community partners for high performance social care delivery, where you can prioritize access to hundreds of social services for your members based on medical necessity. And then finally, we really focus on doing the heavy lifting to establish innovative payment models across the network to ensure that you can get guaranteed results through comprehensive SLAs, performance measures, and risk alignment. I look forward to following up with everyone in the breakout session. Thank you.
Great, thank you, Chris. So now we're going to pivot a little bit, and we're going to highlight 2 of our connection and navigation companies. So first, we're going to hear from Mark from Ready Computing. Oh, there you are. Hi, Mark. Welcome. And yeah, go for it.
Great. Well, first, we'd like to thank the collaborative for the opportunity to speak with you about our Channels 360 solution. I'm Mark Taylor, the Senior Director of Product Management at Ready Computing, and I will be joined by my colleague, James Gallagher, our Chief Operating Officer, in the breakout sessions. We both support government-sponsored plans and programs. A few years ago, we saw an incredible opportunity to combine our deep integration knowledge with an innovative SaaS-based application to support equitable whole-person care. The Channels 360 framework was created to help organizations quickly stand up protocols to engage members and connect them to services, and is a set of tools that supports the composable enterprise, integrating with your existing technology assets. One of Channel's strengths is supporting a network of networks. We work with our clients to consolidate directories from multiple sources into a single hyper-local unified resource. and can include clinical providers like primary care, FQHCs, and other allied health professionals. Another strength is simplified access for community-based organizations who can securely work with their referrals using just an internet browser or through more advanced methods using their native technology. Because we are experts in clinical data integration, we can develop deep connections with provider systems and HIEs to simplify data sharing and access. Outreach and assessment data can be integrated into a plan's analytics engine to inform risk models. And most importantly, we can empower the member to take standardized self-assessments, get recommendations for services in the community, and receive reminders to retake their assessments at set intervals. These are just some of the possibilities with channels, and we are excited to talk more about our solution with you in the upcoming breakout sessions. Remember to join the Ready Computing breakout session to learn more about Channels 360. Thank you.
Thank you, Mark. All right, so next up, we are going to be hearing from Elliot from Unite Us.
Yeah, thank you. Good morning, everyone, and thanks for the collaborative for putting this on and having us. Shout out to all my golf fans that found out this morning that Live and PGA will merge. So super excited about that. Super excited to share a little bit more about Unite Us and hope to see you in the breakout session. So in short, Unite Us builds connected communities across sectors that are traditionally siloed around referrals, data, and care management across government, healthcare, and social services to really streamline the care delivery of wraparound supportive services via electronic referrals, data, and really investing in that whole person health and that whole person care. So bringing everybody on kind of a single shared infrastructure and able to break down those data silos and collaboration silos across those sectors through, kind of a robust suite of tools, whether you're predicting social needs of your Medicaid beneficiaries, serving them within that social care coordination network across those sectors, measuring that impact through a health equity lens, and then ultimately being able to invest in social services the same way we invest in healthcare today. So really our big vision in this space is to bring social services to an even or priority level as healthcare, diverting that total cost from our traditional healthcare systems and addressing the members' needs within the community with those resources and efficient continuum of care. So look forward to seeing some folks in the breakout session, and thank you.
Great, thanks, Elliot. And now we'll shift to our last category around transportation. So we are going to hear from Mindy from Kaizen Health.
Good morning, everyone. My name is Mindy Knievel, and I'm the founder and CEO of Kaizen Health. So I accidentally started a company 7 years ago next week, and I was really just trying to solve a family problem. I grew up in Iowa, and my aunt had MS and needed to get to her physical therapy appointments. And even though I have a large family, it became a very difficult thing to get her back and forth to physical therapy 3-4 times a week, even though she was well enough to stay living at home and take care of herself. A month later, my mother-in-law was diagnosed with stage 4 breast cancer, and these women were very young. My aunt, 53, my mother-in-law, 55. My mother-in-law lived out here in the north suburbs of Chicago, worked full-time, had Blue Cross BPO insurance, a car, money, most independent person I've ever met in my life, and yet she struggled with transportation. There are a variety of other things that kind of led to the formation of Kaizen, but really those two women were the biggest inspiration when I realized that whether you're in urban Chicago or rural Iowa, transportation can be a big barrier. So over the last 7 years, we have built partnerships with health systems and clinics and FQHCs, Medicaid, Medicare Advantage, clinical trials, senior living, home health, K-12 schools. We really transport anyone curb to curb, door to door, door through door, and bed to bed, because the legacy brokers in our space just haven't been able to innovate and keep up with the needs of folks. We've done some pretty fun projects, including with one of the health plans on this call called Rides for Baby, working with Medicaid moms in Columbus, Ohio, to get them to not only their prenatal and postnatal care, but access to food, to the pharmacy, and to social services as well. And we just recently rolled out with a very rural health plan in Minnesota, working with not only your sort of typical transportation partners, but volunteer networks and the public transit agencies to really bring a full network together to serve all of the members. Because yes, it's more difficult in more rural areas, but it can be done. You just have to be more creative and think about things like mileage reimbursement, volunteers, etc. I look forward to speaking with you all in the breakout session. Thank you.
Great. Thanks, Mindy, and thanks to all our presenters for a nice, succinct pitch. So hopefully you all got a sense of the companies that we have here today, and that you're energized about hearing what they can offer. And hopefully you've written down your questions for them. So we're now going to move into our breakout rooms. So of the 5 different solutions you saw, the breakout rooms will give you an opportunity to go deeper with 2 of them. Each breakout room will last about 15 minutes. And each breakout room, there'll be 1 company hosting them. So we'll have 5 simultaneous breakouts happening, and there'll be a representative from MIC or Acumen in each room to help facilitate the Q&A. When there's about a minute left in each breakout room, we'll cue you back so you can finish up your conversation, and then you'll rejoin in the breakout room. And we'll briefly regroup and send you out to your second breakout. So we'll do this 2 times and have an opportunity to delve into 2 different companies. And again, if you're interested in connecting with more than 2 companies, I know it's going to be tough to just be able to pick from 2 of the 5, but we're happy to facilitate those follow-up conversations. At the end, we're going to have a short survey, so let us know then if there was others that you really wanted to see that you were unable to see today. So hopefully that all makes sense. If there's any questions, please drop them in the chat. And now I'll just touch on a few ground rules. So one is we have limited time in these sessions, so keep your questions brief, and company representatives, try and keep your responses short and sweet so that everyone has a chance to participate. As much as we can, if we can try and distribute ourselves across the breakout rooms, the process just works better if we can have small, intimate conversations. So as a prompt comes up from Zoom, you're going to start seeing how many people are in each breakout room, and try and spread yourselves if you can. Also, a quick note on the breakout rooms, we will be recording those, and it's primarily for us to capture questions, and if there's any follow-ups from the state or MCOs, we won't be posting these anywhere. So it's really just for those participating in the process. Okay, so now this is the breakout room. So if, for example, you're interested in benefits data trust, that's room number 1. What's gonna happen is you're gonna get a pop-up screen, and it's gonna ask you to join a breakout room. And so pick the room that's associated with the company that you're interested in, and the MIC Acumen representatives will help kick off that conversation. So Aisha, if you want to open up the breakout rooms, thank you. And we will see you all back in about 15 minutes.
You know, you're going to need to pop me into a breakout room for ready computing, since I'm mobile now and can't get a damn signal.
Can you pop me into 2? This is Dawn from Care Advisors.
You put me into 2 as well, Adam Boris, Care Advisors.
Yes. Join 3.
You put me into 5, Tom James from Passport by Molina.
Yes, number 5.
Thank you.
Aisha, this is Ray. I'm on a dial-in. Can you pop me into ready computing?
Yes.
Thanks.
Abner, I'm adding you to 1. Ready Computing's number 3. Okay. If anyone's having any issues joining the breakout room they'd like to go to, just let me know and I can manually assign you into the room. Fred or Ruth, do either of you need help going into a breakout room?
No, thank you. I've just been mainly interested in following the bigger conversation as a former participant. We were in the first cohort, and I've had back-to-back meetings all day, and I was actually just catching up with email a little bit, and I thought I'd get back with kind of the main conversation and stay out of the way of the states that are trying to work through specific issues and begin a negotiation process and all of that. But I appreciate your facilitation on it.
Of course, no worries. Thank you for being here and thanks for, going through the process last year and joining us again this year.
This is just a great program and effort. And anyway, I think it's going to be cool to follow the bigger conversation around this and may identify some things to take back, So
yes, definitely. Thank you.